You're feeling off and think it might be low T. But how do you actually qualify for treatment? Most people think TRT is for aging, but the FDA specifically advises against using it for age-related decline alone. So if it's not about age, what is it about? Qualification is a strict medical process. It involves proving two distinct things: a confirmed diagnosis and a significant impact on your life. We'll break down the exact numbers, the required symptoms, the critical tests, and the absolute deal breakers for getting TRT. The first step is a blood test. Medically, low T is defined by a specific number, less than 300 nanograms per deciliter, according to the American Urology Association. But the number alone isn't enough. You must also be experiencing significant symptoms, like low libido, erectile dysfunction, fatigue, and loss of muscle mass. It's not just physical. Low T can cause psychological symptoms like depression, irritability, and cognitive difficulties. And one low reading won't secure a diagnosis. Doctors require at least 2 separate blood tests showing low levels to properly confirm the diagnosis. So you have 2 blood tests under 300 ng/dl, and you have the symptoms. Does that mean you automatically qualify? Not necessarily. The next step is to prove that low T is the real cause of your symptoms. Why the need for 2 tests? Your testosterone levels aren't static. They fluctuate based on time of day, diet, sleep, and even stress. Multiple tests ensure it's a chronic issue. Before prescribing TRT, doctors must act like detectives to rule out other culprits, because many conditions mimic the symptoms of low T. For example, fatigue could be from a thyroid disorder or clinical depression. If another condition is the root cause, TRT is not the first course of action. The principle is simple. If treating a thyroid issue resolves your symptoms, you didn't need TRT. This avoids unnecessary lifelong treatment. But what if you pass all these tests? Your T is low, you have symptoms, and other conditions are ruled out. Are there still situations where a doctor will refuse TRT? Consider John, 55. He's tired. His T is borderline at 310. Further tests reveal an underactive thyroid. He gets thyroid medication and his energy returns. No TRT needed. Now meet Mark, 42. Severe fatigue, low libido, loss of muscle. 2 blood tests show his levels are 220 and 240. His full medical workup is clear. Mark is a prime candidate. Finally, David, 65. His T is 180 ng/dl with clear symptoms. But he has a history of prostate cancer. For him, the risks of TRT are too high. He will be disqualified. To answer our earlier question, yes, there are absolute deal breakers, also known as contraindications. These are conditions where TRT could be dangerous. These include a history or high risk of prostate cancer, breast cancer in men, severe untreated sleep apnea, and certain severe heart conditions. Other high-risk factors include an elevated red blood cell count. This is because TRT can thicken the blood, increasing clot risk. Even if you qualify, there's a final vital consideration. TRT is not a short-term fix. For most, it's a lifelong commitment. Starting TRT signals your body to stop its own testosterone production. If you stop the therapy, your levels will likely crash again, and symptoms will return. Given the strict criteria, the risks, and the long-term commitment, it's clear why doctors are so cautious. So what can you do if you don't qualify or are hesitant? First, look at lifestyle. Losing excess weight, improving sleep, exercising, and limiting alcohol can all naturally boost testosterone. There are also alternative medications that don't replace testosterone, but instead stimulate your body to produce more of its own, such as SERMs or HCG. Now, let's circle back to the FDA's warning about aging alone. It makes sense, because symptoms overlap with other conditions, and TRT carries real risks. Age isn't enough. Think of it like a bank vault needing 2 keys. Key 1 is objective data, multiple blood tests under 300 ng/dl. Key 2 is subjective impact, significant symptoms. But even with both keys, a doctor must perform a final security check, ensuring no other conditions are causing the problem and that you have no disqualifying risks. So, to qualify for TRT, it's about meeting strict medical criteria, proven low testosterone, significant symptoms, and a thorough evaluation that rules out other causes. This isn't a journey to take alone. The decision must be guided by a qualified healthcare provider who can assess your individual benefits and risks. Understanding this process empowers you to have a more informed conversation with your doctor. You now know the right questions to ask and what to expect. The goal of the qualification process is to ensure that TRT is the right, necessary, and safe treatment for you. If you're experiencing symptoms, don't guess. Talk to your doctor, request a comprehensive evaluation, and find the true root cause of how you're feeling.